Hello and welcome once again at Med and Health Sports. The research we did today for you is about fractures in sports. First, to put in context, a fracture is a break or crack in the bone. It is usually caused by a trauma, osteoporosis, and overuse. Fractures caused by overuse or repetitive motion are known as stress fractures and are the more common in athletes. Fractures occur in athletes and dramatically influence performance during competitive and recreational activities. Fractures occur in athletes also as the result of repetitive stress, acute sports-related trauma, and trauma outside of the athletes. The literature provides general guidance for treatment as well as variety of statistics on the epidemiology of fractures by sport and level of participation. Also, the athletes are healthy and motivated patients and have high expectations regarding their level of function. These qualities make them good surgical candidates, but also close treatment methods are appropriate for more sport fractures. An aggressive approach to more complicated fractures employing current techniques that may be optimize their subsequent performance.
There are two main types of fractures. Compound, that is open, and simple, that constantly is closed. A fracture is considered compound when the broken bone has pierced through the soft tissues and the skin, creating an open wound. A simple fracture, on the other hand, has little to no damage to the soft tissues surrounding the bone. As we said, there are different types of fractures. One of that, green stick, that is an incomplete fracture wherein the bone did not separate completely. This is common in children because their bones are more flexible. Also, we have spiral, commonly seen in a twisting injury wherein the break spirals around the bone. Transverse, the fracture is a horizontal line across the bone. Compression, where the bone appears crushed or compressed, making it look flatter. This is usually seen in spine. Oblique, the fracture is a diagonal break across the bone. Segmental, a segment of the bone is floating because the same bone is fractured in two places. We usually see this type of fracture in long bone fractures, like in arm or legs. Comminuted, there are three or more fragments of broken bones at the site of impact, and stress, that usually caused by repeat movements and actions that increase the pressure on the bones. All around all different type of sports we have in general, we have different type of fractures. But commonly, stress fractures are most commonly seen in athletes whose sport requires repetitive movements, such as marathon runners. The fractures are also common in contact sports, such as basketball, rugby, and football. The most commonly fractured bones in contact sports are the hands, wrist, collarbone, ankle, feet, and the long bones of the lower extremities.
A treatment for fractures. According to a study in the World Journal of Orthopedics, the goal of treatment in sports medicine is to quickly restore the function of their injured area to help the patient return to play at the soonest and fastest possible time. First of all, we have the rest. The rest do not avoid moving the injury area unnecessary, as this is very painful and can make the fracture worse. Control the bleeding in case of the compound fracture using a sterile of a clean bandage of a piece of clothing. Apply pressure to the wound. Ice and immobilization. Apply apply an ice pack to the injury area prevent further swelling and relieve pain. Do not apply the ice directly to the skin. Immobilize the injury using a splint. You can use a hard splint like a padded board or a cardboard box. For long bone fracture, for long bone fractures and a soft splint like a folded blanket, towels and a pillow for ankle, wrist, and collarbone fractures. Finally, we have the compress that is secure the splint in place using a bandage of a spread of cloth. Do not tie it too tightly as this can impede blood flow. Do not place the ties directly over the fracture area. They should be above and below the injury. Then, then we have the elevate. Once the spleen is secure, elevating the injury can help control the bleeding and reduce the swelling.
Creating that kind of cloth or things to use, so the area that is in danger of injury or fracture, it is protected.